Hello friends, I am Dr. Sachin MUTHA. Today we are going to study the classification of the cholinergic drug. First of all, let us remember, whenever the topic cholinergic drug comes, try to memorize the mnemonic, that is PCM. For P it is the parasympathomimetic and for CM it is the cholinomimetic. Whenever the topic of the anticholinergic drug comes, try to memorize the mnemonic, that is the MAP. M for muscarine, A for atropine and P for parasympatholytic. Try to memorize in cholinergic drug it is parasympathomimetic and in anticholinergic drug it is parasympatholytic. Now let us study the classification of the cholinergic drug. But before that, let us revise some of the neurotransmitters present in our body. The different neurotransmitters in our body are dopamine, histamine, acetylcholine, norepinephrine, then your GABA, glutamate and serotonin. Out of which the cholinergic drug mainly acts on the acetylcholine. We have also studied in Parkinsonism that there is a reduction in the dopamine and increase in the acetylcholine. And in Parkinsonism we have to give the levodopa, which is acts on the replacement action. Now let us study the classification of the cholinergic drug. The cholinergic drugs are again subdivided into two types. That is your cholinergic agonist and your again anticholinergic. For the cholinergic agonist, it is further divided into two types, for which I have made the mnemonic, that is the CHOC, CH for the cholinesterase and ALK, that is for the alkaloids. For the cholinesterase, it is further divided, or I have made the mnemonic for the example, that is the ABC. A is for acetylcholine, B is for betanicol and C is the carbachol. Then for the alkaloids, I have made the mnemonic, that is the MAP. For M it is the muscarine, for A it is your ericholine and for P it is the pilocarpine. Then it comes your anticholinergic. For the anticholinergic, it is further divided into two types, reversible and the irreversible. For the reversible I have made the mnemonic, that is the NC, and for the irreversible I have made the mnemonic OC. Remember, NC, OC. Now let's start for the NC. For the N, that is the non-carbamate, and for C it is the carbamate. Now let's study the example of the non-carbamates. For the non-carbamates, again I have made the mnemonic, that is GEND. For G it is galantamine, for D E it is edrophonium, N it is your non-carbamates, and for D it is your donepezil. Then it comes your carbamates. NC, non-carbamates, carbamates. For the carbamates, again I have made one mnemonic, that is newspaper. For news it is the neostigmine, for P it is your physostigmine, and for R it is your rivastigmine. Then it comes your irreversible. For the irreversible, again which we have made the mnemonic OC. O is for organophosphorus, C is for carbamates. For the organophosphorus, I have made the mnemonic, that is MESS DDT. For M it is malathion, E it is ecothiopate, then for S it is sarin, then your soman. For DDT it is your diflose, then for other D it is your diazinon, which is also called as TIC20, and for T that is your tabun. Remember, the nerve gases together are tabun, sarin and soman. Then your carbamates. For the carbamates there are again two examples, that is your carbaryl, that is which is also called as 7. Try to remember 7 car, so carbaryl 7, and again is the propoxur, which is also called as a bagon. Now let us study some of the adverse effect or the cholinergic crisis, which we have already studied in last video, and for that we have made the mnemonic, that is dumbbell. D for diarrhea, U for urination, then for your M it was meiosis, then for B it was bronchospasm, E it was excitation, then for L it was lacrimation, and S it was sweating. And the exactly opposite action was for the anticholinergic drug. Now let us study some of the uses of the cholinergic drug, for which I have made the mnemonic. Means whenever we get up in the morning, we should say good morning, and we should start our letter with the ABC, and we should eat a puri. So GM, that is the good morning, ABC, puri. For G, the use it is the glaucoma. For M, it is the myasthenia gravis. Then for your A, then A it is for Alzheimer's disease. For B, it is the belladonna poisoning. For C, it is your cobra bite or your curare poisoning. Then for your puri, for P is postoperative urinary retention or your palatic ileus. Now let us study some of the MCQ. First MCQ, which is the drug used to diagnose the myasthenia gravis, and the correct answer is edrophonium. The second MCQ, which is the drug used to treatment for the myasthenia gravis, and the example is neostigmine or pyridostigmine. Then the third MCQ, which is the drug of the choice in glaucoma, for which you have to comment the answer in my comment box. Now I am also planning to make the videos on the MCQ very shortly, which will be soon uploaded in the coming time. If you want more classification or more mnemonics, please like and subscribe my channel. Thank you.